What? All right. Hi, everybody. Welcome, welcome, welcome. As you're coming in, as usual, please let me know in the chat where you're coming from. Where are you? How are you feeling today? How are we checking in? I love reading that in the chat. So I'll write that in. So I'm going to say welcome to everyone. Hi, Evelyn. Hi, Chris. I was wondering if I was going to see you guys first and foremost, or if I was going to see you guys kind of later on in there. Of course not. Hi, guys. Welcome. Please, in the chat, let me know where you're coming from. Let me know how you're arriving today. We have a wonderful, wonderful webinar for you guys. We have some doctoral students from St. Elizabeth who are very, very excited to come in. As always, I'm always so grateful to be here with you guys. I'm so grateful for this opportunity to spend with you guys and for our presenters. The topic is amazing. It's grief support for children and adolescents living with ASD. Today's session is part of our Good Grief Community webinar series. You know, every school year we bring you content. We bring you experts. We bring you, like Evelyn likes to say, sometimes it's good grief experts. Sometimes we phone a friend and just information as a way to extend the work that we do outside of our centers and into this wonderful little virtual family that I've come to love, right? Anyone who is attending today's live session, you will receive a certificate of attendance in the coming weeks. I've spoken to our presenters, and they will also provide you with their slides, and that will come along with the certificate of attendance that Evelyn will send out, or myself. We're a family here. One of us will do it, right? So for those of you who don't know, you know, Good Grief, we're a nonprofit organization. We've been around since 2004. Our mission really is to build resilience in children, strengthen families, and really, you know, empower communities to grow from loss and adversity. Most of our organization's history, we've been providing free, and I like to say that nice and slow, free and unlimited peer support programs to grieving children and families, starting at age 3 and going through young adulthood. And we do this in our centers in person. We have one virtual session, but for the children, we do it in person in Morristown and in Princeton. In recent years, our work has been growing, thank goodness. And through education and advocacy, we're able to provide webinars like these, training, curriculum, and resources to schools, to hospitals, the funeral industry, corporations, and really just any space where we can empower professionals and parents and the broader community to support the needs of children and families facing loss and adversity. So, with that being said, I'm going to invite our panelists, our presenters, to turn on their cameras. They're going to introduce themselves to you, and you're in for quite an informational treat. So, I'm going to hand that over to them. I will be monitoring the chat. So, if you have any questions, please feel free to put them into the chat, and I will let our presenters know. So, I hand it over to you guys.
Thank you for that. So I'm just going to introduce myself. I am Catherine. I'm a third year doctoral candidate at St. Elizabeth University. Um, I am currently doing my training in private practice settings that specialize in OCD and anxiety related disorders. We primarily do ERP for those populations. Yeah, so my approach has really just emphasized humanistic foundation with some CBT incorporated. So if anyone else wants to introduce
Wonderful,
themselves
Catherine.
next.
Hi everyone, I'm Eliana. I'm a second year doctoral student at St. Elizabeth University. I have experience working in a private practice with private clients, but also clients who have an active case with DCPMP. So I offer individual therapy. I also do psychological evaluations with different types of tests and assessments. I use mostly cognitive behavioral therapy and person-centered approaches when I work with children, adolescents, and adults in individual therapy.
Thank you, Eliana.
Hi, my name is Connor Clark. I'm a third year doctoral student. In my previous externship, I was working in a school setting, working with a variety of children. And I was also doing some intelligence and behavioral testing as well. Currently, I am working in a partial hospitalization intensive outpatient setting, specializing in eating disorder treatment. I utilize a CBT and person-centered integrative approach. The program is also set up so I'm getting some education as well with regards to family-based treatment, which is the gold standard for eating disorder treatment. And so I do individual therapy, group therapy, and I also help in intakes as well.
Thank you. Thank you so much, Connor.
Hi everyone, my name is Kat. I am a third year doctoral candidate at St. Elizabeth University. Last year at my previous placement, it was a nonprofit and it was a training institute, and we worked with Medicaid clients, specifically low-income clients, doing pro bono work, and we were doing a wide variety of different cognitive behavioral treatments. I'm currently in a school setting and I am doing cognitive behavioral treatments, individual therapy, group therapy, as well as some cognitive and intellectual assessment testing.
That is amazing. Thank you guys. Such a wealth of knowledge you guys have individually and collectively. I'm so excited to see your presentation for today, as are our participants, I'm sure. So I'm going to go ahead and mute myself and let you guys take it away.
Yeah, so I'll just share my screen now. Can you guys see it?
Still loading. Oh, there we go.
Good, okay.
Okay. So I will get us started. So today, as you guys all probably know, we will be talking about grief support for individuals living with autism spectrum disorder, specifically child and adolescents, of course. So we can go to the next slide. Uh, okay. So how we have it organized, I think it's important to kind of start from the ground and work our way up. So first thing we're going to talk about is, oh, can you go back? Yeah. How do children and adolescents living with autism spectrum disorder understand and perceive death and grief? So, how are they really understanding this entire concept while keeping their cognitive, emotional, behavioral, and sensory differences in mind? So, we'll get into that a little bit to start. Then we'll move into how to effectively communicate death with children and adolescents living with autism spectrum disorder, and then healthy coping strategies for both children and adolescents living with ASD and their caregivers, professionals, and educators to promote their own self-awareness and resilience during the grieving process. Because it's not just about the child or adolescent with ASD experiencing this. Their caregivers, whether it be personal or professional, are also, of course, involved in this as well. So we need to make sure that everyone is handling this appropriately and in a healthy manner. Okay, so to start off, we have to think about sort of when it comes to autism spectrum disorder, what are some of the differences in terms of how an individual with ASD might be thinking versus an individual without ASD? So to start off, we have the theory of mind, which kind of helps to explain a little bit of this difference. So we as humans, we like to predict the behavior of others and read one's emotional states, right? So from an early age, we tend to think about how others might respond to an action that we do. We try to predict their behaviors, their thoughts, their feelings, their emotions about those behaviors and what we might do, what might be the outcomes, right? So we use this information to understand how people are feeling and what they know based on exposure to certain events and how we should interact with this person. So if we tie it in with grief, for instance, if an individual does not know yet that someone has passed away and we are the ones breaking the news to them, we know that breaking the news will likely lead to something of sadness, anger, frustration, some of those emotions. So those are kind of the expected emotions when we would be breaking news like that, for one example. So these components all together of human behavior and understanding kind of come together to create the theory of mind. And we begin to develop this around the ages of 2 and 4. So as we're developing and growing, we're beginning to realize that people have their own individual thoughts, feelings, emotions about certain events or certain knowledge on certain events that are leading to those thoughts, feelings, and emotions. And that sort of a mindset and emotional state and things like that are quite autonomous. And not everyone has the same feelings all the time. So, for those with ASD, theory of mind seems to either be delayed or doesn't necessarily reach the same sort of capacity that someone without ASD reaches. So, they may develop what is called mind blindness, which leads to actions that are deemed to be inappropriate for the situation and can lead to a struggle in asking for support. So, to put this into an example, right? If someone were to tell their daughter or son that they're going to a funeral and that a funeral is a celebration of someone's life. One of the pieces of literature mentioned this, that they might, laugh and joke around at the funeral, which to others might seem to be an inappropriate behavior for what is going on. But because the individual living with ASD was told that it was a celebration of life, they kind of paired together sort of humor and more positive moods for that setting. So that is just one example of how mind blindness can potentially disrupt an event like this. And theory of mind helps us explain why children with ASD may differ in action, interaction, and also empathy. So if we go to the next slide, another member of our cohort, her name is Alexa. She does a fantastic job kind of always discussing autism spectrum disorder and is really well versed in it. And she came up with this diagram to kind of represent theory of mind. So if you or I, we're looking at this diagram, right? We see a bear in the girl's box. She then leaves, and the boy puts the bear from the girl's box to the boy's box, and then she comes back. Now, if someone were to ask us who are witnessing the scene, what box would she check? We would be likely to say her own box. And the reason why is because although we saw the bear being switched around, she wasn't present for it. So we know she isn't privy to that information. Whereas with someone with ASD who's observing this, if you ask them where she would be most likely to check, they would say the boys box. And the reason why is because although they have the information, they aren't necessarily aware that the girl in this case is processing the same event without that information. So the kind of being able to differentiate that people have different understandings of situations, different knowledge levels of situations that are influencing mood, feelings, and communication and behaviors as well. That is a little bit tougher for someone with ASD. So that's what theory of mind helps us sort of understand. Okay, so now we're going into how death is really perceived, now that we have like a little bit of understanding of sort of what is going on from a thought process standpoint. So the first thing I'm going to say is that death is complicated for anyone to understand. If you have ever lost a loved one, it comes with a large amount of emotions, sometimes overlapping. It's hard to, parse them from one another. It's hard to articulate how you're really feeling in that moment. Um, and that's going with the mindset that death in of itself is an abstract concept. And it can be difficult for a child or an adolescent with ASD to comprehend. One of the articles about, death and grieving and discussing it with children with ASD talked about how there was research done, and we in the United States use 51 different euphemisms for death. So, for a population such as individuals with ASD who like information in a concrete format, it's a lot harder for them to grasp such an abstract concept. We are not, helping at all as a society because we are just using a variety of different terms and making it even more abstract for anyone to kind of understand. So, with that said, social emotional expression And communication can make it hard for those with ASD to relate to others and receive the same social support as neurotypical children do. So, if a child or an adolescent with ASD, you know, is experiencing one type of emotion, they're expecting everyone in this setting to experience that emotion with them. So, if someone else is experiencing, let's just say, sadness while they're experiencing frustration, they might not be able to relate to that person or empathize with that person on the same level as someone without ASD would, right? And so that can also affect communication because, they are given the same information about the death or the loss of a loved one as maybe someone else within the family. So they may potentially assume that what they need in those moments, and that communication might lack because a child or an adolescent with ASD might think that everyone's on the same page with what is needed. So another potential issue is the underestimation of future impacts of the loss. So, you know, children and adolescents with ASD are usually present-minded. And so when it comes to future-oriented thinking, it's not always at the forefront. Of the mind. And so that kind of goes into the next bullet point, that the loss of someone could affect schedules and recurrent events, which may cause distress. And that's because, let's just say, the person that they lose is a loved one that picked them up from school every day, or, took them to their extracurriculars, something along those lines. While in the moment, they are experiencing the emotions that come with, or trying to comprehend the death of someone, they aren't necessarily processing how it's going to affect them in the future. So that may lead to more distress that occurs over time while they're still trying to grieve, sort of reopening that wound in a sense for them. And it might make it harder for them to grieve during that time. And then that goes into the next standpoint, that a lot of individuals, children and adolescents, may have comorbid anxiety and depression with autism. And so this might get exacerbated due to the stress that they're feeling from the loss of rigidity of their schedule. So we have to keep that in mind as well. They might, already have anxiety and depression, and it might be, to a greater severity during this grieving and loss. It might be that, they didn't have it before, but now we're seeing signs and symptoms of it. So it's important to keep that in mind. Um, and then what I'm saying here with the struggling with the gestalt and translation, it's a very interesting piece. The literature talks about how there is a pairing that goes on, almost an overgeneralization that is going on with, if you have a child or an adolescent with ASD who is visiting a loved one in the hospital, right? And, they visit a few times and then that loved one passes away. There's a good chance that the individual or the child or adolescent with ASD might now pair together any time going to the hospital with death, and that anyone who goes to the hospital is going to die. So they aren't necessarily pairing that the illness that that person was experiencing was the reason for the death. And so environments might become a little bit more stressful for them. And it might be something that we have to work to kind of differentiate over time. And then finally, children with ASD, they may feel lost in other ways too. So we talked about the rigidity of schedule. The literature brings up a really good mention of just sort of, one example might be a new school year, which means new classes and a new teacher. And so they might have a hard time adjusting to that. They might feel a sense of grief and a sense of loss because they are no longer now with their previous teacher or their classmates that they felt comfortable with. And so in those moments, you might see them sort of experiencing that transition in a similar way to grief overall.
Okay, so here I kind of want to highlight just some of the common bereavement practices that seem, typical for you and I and most people, but it can actually create some significant challenges for people living on the autistic spectrum. So the literature kind of points out that it's not necessarily the grief itself that's creating the biggest barrier, but rather the sensory processing demands of the rituals that surround loss. So, the first example is formal attire and the unexpected smells. So clothing that feels stiff or scratchy, tight collars, or the expectation that they need to dress up. It can create a lot of stress and discomfort for somebody who has sensory sensitivities. And then if you add in like all of the different smells that are common with funerals, like perfume, flowers, incense, and things like that, um, they can quickly overwhelm and um, become really distressing for somebody who already has a dysregulated nervous system in an unfamiliar setting. And so we just want to be mindful of that. And then there's the physical actions that we commonly do when we're grieving, like hugging, handshakes, other forms of physical comfort that are typically associated with um, death in those situations. So, individuals living with autism may find physical touch to be uncomfortable. They might find it unpredictable. They might even find it confusing, especially when their emotions are already pretty high. Um, and then they also might just find it challenging to be in the unfamiliar environment. So, funeral homes, churches, cemeteries, all places that we commonly associate with um, death might be completely new and filled with social expectations that aren't clearly communicated and then create like a lot of distress just due to the novelty that is there, and it can heighten anxiety and disrupt the child or adolescent sense of safety. And then finally, we need to consider the language that we use. As a society, we often rely on abstract or metaphorical language, such as they passed away or they went to a better place. Even the term lost can be kind of confusing for someone who has autism and they're interpreting language literally. Um, and Kohler in 2016 really emphasizes the importance of concrete explanations so that the child doesn't have to guess at what the meaning is, and just doing that can create a sense of like safety and comfort for that individual. So the big takeaway here is that many culturally normal practices around grieving can unintentionally overwhelm individuals living with autism, and oh, I'm so sorry. Um, just like these sensory and cognitive barriers allows us to be more intentional when we're making the choices around how to um, practice loss when we're including somebody who has autism.
So like Connor and Catherine had just shared, it's important to consider how we approach conversations surrounding death with children and adolescents living with ASD. So like Connor mentioned in the beginning, death is a topic and a concept that can be complicated for anyone to understand. But given its abstract nature, it can be especially difficult for children and adolescents with ASD. Some people may believe that children and adolescents with ASD may not be able to grieve or understand the concept of death, and this could lead to exclusion from the overall grieving process and any rituals associated with death, such as going to a church or going to a funeral, to the cemetery. However, just like everyone else, children and adolescents with ASD can grieve the death of a person, and they can ultimately understand what death is. So, conversations surrounding death may be a bit more challenging for children with ASD. You may need to give them more time to process the information and more time to revisit the conversation, but this doesn't mean that they're not able to have the conversation or they're not able to understand it. So, given the difficulties that are typically associated with autism, such as understanding, communication, and interpersonal skills, it's important to effectively communicate death with children and adolescents with ASD. So in the next few slides, we'll go over some tips of how to effectively communicate death with the children and adolescents with ASD. So Some tips are the first would be don't avoid the topic or the conversation. So research has actually shown that the grief reactions of children with ASD were found to be similar to children without ASD. Withholding information about death or the conversation or even using confusing language can actually increase the child or adolescent's distress, and it could also cause confusion or fear among them. So it's important to have the conversations with them so that they're able to understand and that they're ultimately able to grieve the person. So based on research, it's important for them to be able to talk about death in general, but also to talk about the grieving process and their feelings around death and the grieving process. Children and adolescents with ASD may struggle in understanding abstract language and concepts. So it's important to consider the language that you use around the topic of death. So, based on the literature, it's been more beneficial to describe death in direct, concrete language and terms, avoid flowery or abstract phrasing, avoid using euphemisms and unclear language. Euphemisms can be misleading or they could be taken literally. So, this can create more confusion to a child or an adolescent with ASD, especially if it's their first time talking or learning about death. Phrases such as passed away, went to sleep, or other ambiguous language can be confusing. So research has recommended to use more direct language, such as death, dead, died, or body stopped working instead. This way, the words are more direct and concrete, and it won't cause any confusion to the children. It's also important that when you're having these conversations to use honesty. So don't lie or underestimate the child or the adolescent's understanding of death and the situation surrounding it. Children and adolescents with ASD can often detect any inconsistencies and they may become distressed by the uncertainty or the not knowing. So although it may look a bit difficult, children and adolescents with ASD are able to understand death and are able to go through the grieving process also. So when we have these conversations with them, it's important that we use the correct language and honesty with them. You can also use and teach the vocabulary of death, such as any medical terms, to make the conversations more concrete and perhaps easier for them to understand. And this could also help to avoid any confusion. It's also important to take a direct approach to the conversation. So, like we mentioned, to use direct language and honesty, but it's also important to keep in mind to not overwhelm the child or adolescent with too much emotion or too much involvement that they may need or they may want. So, try to balance being honest with them and having direct conversations, but also keep in mind their emotional regulation. So, don't overload the child or adolescent with adult level distress. So when we're talking about death and grief, try to keep the child or adolescent's needs in mind. So this can include their mental or their physical health, any developmental needs, and any sensory communication or interpersonal difficulties. You can also try to adjust the conversation, so just how much information you're providing at one time, depending on their needs. And you can also keep in mind that you can revisit the conversation and continue the conversation at a later time if you notice that the child or adolescent becomes too overwhelmed or too overstimulated.
So, as Eliana was mentioning, I just want to make sure I'm on the right slide. Give me 1 second. Oh, it's not letting me go back. Okay, so as Eliana mentioned, we kind of want to keep the explanations factual and simple. We want to give only the information the child asks for or seems ready to hear. You can discuss and acknowledge the feelings and emotions surrounding death and coping with the change that has occurred. We want to avoid using fear. Death should never be explained through threats, or any other frightening interactions. Um, it's also very important to help them differentiate between temporary loss and permanent loss. So, for example, if their teacher goes on maternity leave for a few months but will return, phrases like when we meet again or we will all be reunited are appropriate. But if the loss is permanent, as such with death, those phrases might be difficult for children and adolescents with autism to understand. So, although they might be spiritually meaningful for many people, um, we kind of just want to avoid anything that can be ambiguous or abstract. Even the term loss might be confusing for some people on the autism spectrum disorder. I mean, on the autism spectrum. So research also shows that being cautious with religious explanations, as they are often as abstract or symbolic, and they may cause confusion as well. So we always want to return to clear and concrete language. And so one of the most important things is adapting communication to the child's developmental level, as we previously discussed. So this means giving information that's concrete and easy to process, avoiding euphemisms, um, and emphasizing clarity. Um, it's not only helpful, it can actually be protective. So things like books, movies, and articles, they can be wonderful tools to use when communicating death to someone who has autism, because it kind of creates some distance between the child's personal experience and the story that's being told. So when the content is external, and it's about like they're following a storyline, it's about a different character, um, children often feel safer when they're processing it. It also provides some structure and visual guidance, which many autistic children tend to rely on. Different things like crafts and memory activities are another great option. You could create a memory box, decorate a candle, draw a picture of the person, and that really just kind of helps them externalize their feelings. And it offers activities that are predictable and concrete in a way that honors the individual who died. So, stories are also very useful for explaining the concept of death and as well as the emotions that are surrounding it. So, many children with autism benefit from seeing emotions represented visually or verbally or both. And stories kind of give them a script, which reduces the uncertainty about how they're, quote unquote, supposed to feel in these situations or how they're supposed to respond to somebody who died. And we also want to remind children and adolescents that memories are still accessible to them. So helping them understand that remembering the person, such as like looking at photos, talking about experiences they shared together, really just like keeping their memory alive, can help them feel connected to the person who passed away. And even though the person is no longer physically present, it can help them just really cope with it in a better way. So it aligns with more contemporary grief models that focus on maintaining the continuing bonds in a healthy way. The overall goal really is to provide concrete, predictable, and emotionally safe ways for children to understand what's happening and then feel connected in a way that fits their communication style.
Hi. So now we're going to talk a little bit more about how we can support healthy coping mechanisms for both children on the spectrum and for yourself, which is going to be the next slide, as they navigate grief and loss. And so, like mentioned, children with ASD often process information differently, especially around something as abstract as death. And so, our goal is to make understanding concrete, predictable, and sensory friendly. When talking about supporting understanding and emotional expression, my colleagues did an excellent job at kind of explaining the communication and the visual importance of that. So, making sure that we're avoiding euphemisms and that we're using clear, direct language. This is really important because misinterpretations is shown to correlate with increase in sleep anxiety, increase in fear, or increase in magical thinking. And similar to what Kat just said about visual supports, these are also really essential. Tools like social stories, timelines, and picture schedules, they can break down overwhelming experiences. And so they allow the child to process the sequence of events and reduce ambiguity. Repetition is also another key strategy. So many children on the spectrum need to revisit information multiple times to fully understand it. So we provide consistent opportunities for that review. And we check comprehension rather than assuming the message is stuck the first time. So an example of this is a child might ask, "Where is grandma?" many, many times. And so It's going to be really important, and yes, easier said than done, to respond consistently and calmly with the same language each time. Repetition is part of how children on the spectrum process and integrate emotionally charged information. Most importantly, we want to make sure that we're supporting emotional expression in ways that feel natural to them. So, this may be through the use of an AAC device, drawing, music, or even their special interests. We follow their lead and we give them tools that match how they communicate rather than forcing typical verbal expression. Regulation and predictability. So, after a loss, routines often do get disrupted, and this can dramatically increase anxiety for children on the autism spectrum. Maintaining their normal routines as much as possible really does become a stabilizing force. And so, keeping bedtime, meals, therapy sessions, any morning rituals, any nighttime rituals, keeping these unchanged during the grieving process as much as possible is going to lower anxiety and restore a sense of safety. Any upcoming grief-related events, so kind of similar to what was already previously discussed, like funerals, wakes, schedule changes, these should be previewed in advance when possible. When we give them visual rehearsal, we can reduce uncertainty. So, for example, showing pictures of the space, of the funeral home, of the church, describing step by step what is going to happen, or practicing phrases that they may hear. Um, One thing that you can do is create a social story. And so this is very linear. What happened, discussing the death, who will be at the funeral, and what the child can expect to see, kind of in that order. Research shows the social stories help reduce confusion and support comprehension. We also want to proactively provide sensory accommodations, so headphones, a quiet space that they can move to if necessary, weighted items. A lot of these can help children tolerate the environment that may be overwhelming or emotionally charged, as previously said. Traditional grief rituals may not feel accessible or meaningful to autistic children. So, providing options gives them agency. It lets them participate in a way that matches their own sensory and emotional needs. And so, my colleagues gave some really good examples of that, such as memory boxes, drawing, photo albums, symbolic activities. One of these can be creating their own candle and lighting it, or choosing an object that represents the person who passed away. And so these types of rituals offer containment and connection without requiring participation in overwhelming ceremonies. And so it's really important to emphasize that the key is allowing participation at their own comfort level. They can choose what parts of the ritual they want to engage in or whether or not they want to engage in at all. We're going to talk a little bit about behavior as communication. So it's really crucial to remember that grief, excuse me, for children on the autism spectrum often shows up behaviorally rather than verbally. And so you may see an increase in meltdowns, irritability, regression, or rigidity. These behaviors often are not defiance in this context, they're communication. And so many of these children, it signals that they're overwhelmed and dysregulated. So some of these can include increased scripting, insistency on the same. So example, we always go to grandma's house on Sunday. That can relate to routines and some other physical manifestations of symptoms like bedwetting, clinginess, or refusal behaviors. Our responses, it's going to be really important as caregivers to be as empathetic as possible to provide that structure and co-regulation, and decreasing punishment as much as possible. Very similar to what Connor Clark said in terms of that conditioned association, right? We want to make sure that we're not conditioning punishment with that with those highly emotional feelings, right? We want to model calmness, help regulate their bodies, and offer predictable support so that they could feel safe. Um, so some of these ways that you could do that include using visual feeling scales, right? So pointing to sadness, anger, confusion, use of drawing, use of their AAC device if that's something that is used to point to words like miss, love, sad. Other types of different creativities, or even including their own special interests in this to represent the loss. And so it is important for me to emphasize that many of these behaviors in this context are not misbehaviors, they're grief responses. Um, so those are the core different types of supports: clarity, predictability, and sensory accommodations, and interpreting behaviors through a trauma and ASD formed lens. And so, Kat, you could skip to the next slide. I'm going to talk a little bit about caregivers. No, it's already on it. Okay. Um, Yes. So when we look at caregiver functioning, we see that there is a powerful reciprocal relationship. So the caregiver's emotional stability directly affects the child's stability. And so this slide really focuses on on how we can support caregivers through their own grief while helping them remain grounded for their child. Um, Grief for caregivers of children on the spectrum grief for caregivers in general is often complex and ambiguous. And so they may grieve multiple things at once, whether it's past losses, the child struggles, the death itself, that relation to the death for themselves. It can be a very emotionally taxing load, and it can be really heavy. And so normalizing the complexity of the grief reduces shame and guilt. We really want caregivers to be able to name the emotion directly without minimizing them, both with themselves and with their children, or the child that they're taking care of. And so, caregiver awareness and emotional regulation, we really encourage caregivers to assess their own emotional state regularly. You could do this doing short daily check-ins that help identify exhaustion, overstimulation, and emotional overload before these experiences begin to spill into interactions with the child. And so, we also address internal pressures, right? Things like, I should be coping better. A wonderful mentor of mine told me once that there's no such thing as should when it comes to grief. And so I can't emphasize that enough. It's going to be really important to help shift that caregiver model towards self-compassion. Their emotional health is not a luxury. It's a necessity, and it is foundational to effective caregiving on its own. And so strengthening communication. We talked a little bit about this before. So consistency in language across not just caregivers, but also professionals that may be included to help is going to be really important. Mixed messages, especially to children on the spectrum, it can deeply confuse them and it can cause more distress. And so it's going to be important to model healthy emotional expression, acknowledging sadness while reinforcing safety. This is going to help the child understand that emotions are manageable and that they are not dangerous and that it's actually really important for them to feel it. We encourage caregivers to seek grief-informed and ASD-informed support. This can include parent groups, community service, or counseling. Caregivers often feel isolated, and so widening their support networks reduces emotional strain, such as a community resource like Good Grief. We also highlight the value of coordination with schools and other clinicians. A team-based approach ensures that there's consistency for the child across different settings. Protecting caregiver well-being is obviously also important. Basic needs, sleep, meals, movement, they seem very simple, but often they're the first things that end up going during grief. And so reestablishing these rhythms, like we talked about the importance of structure for the child, this type of structure is also going to be really important for you. And it can help build caregiver resilience. And resilience is not, again, just for the caregiver. It stabilizes the child by providing emotional predictability. And so, lastly, I kind of want to talk about when it might be appropriate to seek professional support. So, we really want to normalize help seeking. If caregivers experience persistent hopelessness, significant functional impairment, withdrawal, or overwhelming anger, many of these can be a sign that professional help is needed. And I want to emphasize that acknowledging these limits is not a failure. It's protective for both themselves and for the child. And so overall, supporting grief in ASD requires a dual focus, meeting the child's developmental and sensory needs while also caring for the caregiver's emotional world. When we strengthen both of those sides, we create a stable foundation for healing and adaptation.
Thank you guys. This was amazing. We do have a question before I cut you guys loose. We do have a question. One of our participants is asking, are you able to provide some examples of coping strategies for those that work in education as youth workers? Do you guys have any, does anyone on the panel have any advice for that? Any answers for that? We'd greatly appreciate that.
I would say that some of these depend on the age of the child. But there's many different creative and visual. I When it comes to emphasizing the importance of meeting the child where they are for how they're going to process, if you have a child that is very, very visual, having them use so one of the examples that I'm thinking of is mostly for like the littles, like five and below, using stuffed animals to kind of reenact these specific events that would happen. Again, repetition is something that can be really important for processing. And so for that age range, that was one of the coping like strategies that seemed to be helpful. Um, I'm sorry, is there a specific age range? Because I could
They didn't put, but if oh, let's see, they put it in high school.
high school. Um, I am not at the high school. And so my experience is going to be with eighth grade and below.
Mhm.
Um,
Does
I'm
anyone
not
else have
entirely
any
sure.
experience with high schoolers? I would, I mean, and this is of course an opinion, but I would think that, of course, when we're talking about those with intellectual disabilities or those in the ASD community, we always want to think about where they are developmentally. So yes, maybe they are in high school, but maybe developmentally, they are not at that level just yet. So it's really important to help them and to assist them with where they are developmentally. So if they're developmentally, let's say, like you said, Catherine, 5, 6, 7 years old or something like that. Social stories, like you guys mentioned, are really, really good. Repetition, as is with the children that also come to our centers as well, right? Repeating things, doing social stories I love because they're good at any age. And I think that that really, really helps a lot. So I would go with their developmental age and social stories. We have another question. Information explaining the death of someone with ASD. However, can you speak to supporting a young adult who is having a tough time in a peer setting? Do you guys have any advice on that? I'm assuming that they mean a young adult that has ASD. Hopefully, they'll write back and let me know. We have that question. We also have, we've encountered parents whose young person was struggling to grasp the permanence of death and asked daily where the other parent was, which I'm sure is so hard. What can they do to take care of themselves and the young person, and how do they navigate this healthily? Anyone have?
Yeah, so a lot of kind of what I've just talked about. Again, when we talk about repetition, especially when there is a routine that is broken or the person was living with them very close within the home, it is going to be important to maintain that consistency of language across the board when these questions are asked. When it comes to healthily coping as the adult and as the caregiver. Many of the things that I just mentioned, making sure that you are, because I want to emphasize when I say that, I recognize that it is much easier said than done, and your frustration tolerance can d diminish, and so making sure that you are taking care of those basic necessities for yourself. You're eating, you're sleeping, you are engaging in things that bring you pleasure as well, and then as well as recognizing those uh, frustration, hopelessness, significant overwhelmness. Those may be times to reach out to a mental health professional, community resource service for assistance, not just for yourself, but that also can assist your child as well, because you don't have to do it alone. There's people who can help.
Right. And you also want to make sure that everyone is on the same page so that what you're saying, everyone else is saying. Connor, did you want to say something?
Yeah, I was going to say something very similar to what you were just talking about right there. Making sure everyone's on the same page. I think also, as frustrating as it can be, and it might be very hard to do this, but kind of looking back and kind of having that moment of self-reflection. Am I using the correct terminology? Am I being consistent with my phrasing? Things like that. Just reminding that, people have a tendency and just a natural instinct to talk about death in a more abstract manner. And so, you might not even realize that you're doing that. So maybe going back and thinking about, what are the words and phrases that I'm using? Am I using them, all the time? Am I accidentally mixing in some other phrases that could be confusing them? So, yeah, I think that that's another big part of just sort of that sort of reflection on how could I potentially be doing this better?
Right, right. Yeah, let's see. I don't know. I don't think there are any other ones, but I want to make sure. I want to give everyone the opportunity uh, to answer. Nope, I don't think we have any more. Thank you so much, guys. I really, really appreciate this. Thank you for being here today. Thank you for the thoughtful attention to your slide deck, to your resources, to your references, everything that you brought to this conversation. I am so incredibly thankful for. Grief in the ASD community is often, not just grief, but just the ASD community in general, is often overlooked and really misunderstood. And I think you guys did a really good job at kind of dispelling those myths and giving some resources to those who logged on today. And for those of you who logged on today, your dedication to expanding your knowledge really helps change how we view this, how we talk about it. We really look forward to seeing you at upcoming webinars, where we're going to deepen our understanding and improve the supports available to all individuals and their families who are grieving. Just a little plug for next week, for next month, rather. Oh my goodness, next week. For next month, we hope that you'll join us for that session. It's going to be Grief in the Garden, returning to nature for solace and strength. And we're really just going to explore how gardens and aromatherapy can support the grief journey, how plants communicate through scent and symbolism to offer comfort, emotional insight, opportunities for reflection, and just healing and grounding ourselves in nature's wisdom. So I'm really, really excited for that. Thank you all for being here with us today. Thank you to the St. Elizabeth students. You guys were amazing. And please, please continue to come to our webinars. When we send you your certificate of attendance, there will also be a survey there. So you can let us know what other topics you would like, how you felt about this topic specifically. Should we bring our friends back? Please let us know. Oh, also in the chat, I think Evelyn just put it in. Thank you, Evelyn. There is a Zoom link to register for our next webinar. So with that, I will give you back about 6 minutes that you guys have to your day. And again, thank you so much for being with us today and have a great one, guys. You guys were amazing. Thank you so much.
Thank you so much for
Thank
having us. We
you.
appreciate
Yeah.
it.
Having us.
Guys.